Hello everyone. Hi. Welcome to the session in which basically I'll be talking about how do you use a test and discussion. For anyone who's planning to buy a test and discussion or anyone who is already a part of the DBMCI test and discussion, what is the ideal way to use test and discussion depending upon where you are, what your baseline level is, where you're actually standing. I'll give you basically a walkthrough on what test and discussion is, how it helps and how you can use a test and discussion to ace your exams to get the rank that you desire. A little bit of nostalgia. I'll start with a little bit of nostalgia. So I myself have been a student of DBMCI test and discussion back in 2017 and 18. Uh, I was not a regular coaching student, third, fourth year, or something like that. I was a test and discussion student, like a genuine test and discussion student. So I think I feel it's like kind of a circle coming, life of circle happening. Now I'm a faculty here at DBMCI, and let me guide you on how actually you can use test and discussion properly. All right. So the first thing that I'm going to talk about, hi Nidhi, hi. Yeah. So the first thing I'm going to talk about, what's the goal of a test and discussion? Like, how is a test and discussion different from a regular batch? And why I use test and discussion, how you can use test and discussion. So first of all, you have to understand that the goal of a test and discussion always is what? The goal of a test and discussion is to give you a schedule, to give you a schedule. So it is basically for those, a lot of people, the problem with any, like, let's say you're doing a total online learning versus someone who's using a test and discussion or who's in a regular batch. Not talking about regular batch, but let's say someone who's doing totally online learning. That requires a huge amount of self motivation. I'll be very honest. You have to yourself figure out, I'll do this, then I'll do that, then I'll do that, and keep yourself motivated during the entire 6 month, 1 year journey. That is the problem with a sort of self-based approach. That is the major and the biggest problem with a self-based approach. Most of people tend to end up faltering. That's why, right? The main goal of a test and discussion, it gives you a schedule that in this week you have to get done with this particular topic, that in this week you have to get done with this particular subject. In this week, after this, I'm done with the reading of my subject, I'm done with the Q bank or the previous year questions. Now let's attempt a test which has been curated by the faculty. All the questions are curated by the faculty depending upon how the previous year questions and the previous year topics are being asked and how they can flip it around. No question in a test and discussion is an actual PYQ. All of them are twisted PYQs, slightly twisted, so that they give you a flavor of how the exam will be similar to past exams also, but still different. That schedule and the twisting of the previous year question and flavor of the previous year question is what defines a test and discussion. And then, of course, a discussion following, talking about all the important topics, giving you crisp and concise notes. So, three goals: schedule, seeing how actually questions are made, how actual questions and exams can come. Right? A lot of people, they do theory well, but they don't know how to solve MCQs. So in a test and discussion, when a faculty is himself discussing MCQs with you, he will tell you that this particular MCQ, this was a previous year question like this. Now I've given this question like this, or the examiner can give you this question like this. That is going to help you in improve your MCQ solving ability. So schedule, MCQ solving ability. And the third important goal of a test and discussion is getting crisp and concise notes for a last week revision. So maybe not the major subjects, but at least for the minor and the mid subjects, for example, subjects like pediatrics, orthopedics, and derma, the content which is covered in 1 day test and discussion is actually enough for the last 10-day revision, last 7-day revision, because it's the most important, most high yield topic which is already being covered in those particular tests, which is already being covered in that particular test. All right, so that is the goal of a test and discussion. Schedule keeps you on track with your preparation, uh, shows you, improves your MCQ solving ability by showing how previous year questions can become twisted, and a faculty discussing it and getting you a set of concise notes for the last 7-day revision. All right. So this is the major goal of a test and discussion. Now, coming to how someone can use a test and discussion, I'll categorize students into two broad categories actually. For those who are not giving CTs, or those who are giving CTs, but their scores are sort of stuck. So first, I'll start with people who have not given, started giving GTs yet. For them, I will say start giving GTs first of all. The best day to give a grant test was yesterday. The second best day is today, and the third best day is tomorrow. That's a very common saying, I would say. Now, the For those who are not giving GT, what I'm going to tell you is these tests and discussion, they're going to serve as subject-wise tests. So after 3, 4 subject-wise tests, after 3, 4 weeks, a lot of people, they are not able to give GT because simply because they don't have the confidence to give a GT. They think they will give a GT and they will like falter. They will get like probably score a 0 or probably score a 5 or a 10. That's simply not true. When you start a test and discussion, what's going to happen after 2, 3 weeks, even if you don't have the confidence to give GT right now, after 2, 3 weeks, what's going to happen by solving these tests, by solving these subject wise tests, your confidence slowly and slowly will build up. And by the time the third and the fourth test is there, you will have the confidence to start giving GTs. So you'll get on track. All right, so you will get on track. That's the best part about, giving starting with a test and discussion. Seeing people around you will also give you a boost that there is a competition. If you study alone, what's going to happen? You are your own competition. You might lack off, you might sleep, or you might watch Netflix and you might Netflix and chill and things like that. But when you see 10 people around you actually asking questions, giving a subject wise test, if not the entire test, by dividing the entire GT into the subjects by these tests and discussion, slowly you'll get confident. And by 3, 4 weeks, I'm pretty sure you'll be having enough confidence that you are going to start to give GTs. So this is a simple thing for the people who are not giving GTs right now. It will help you build the confidence to start giving GTs at least. Coming to the people who are already giving GTs, but let's say their scores are stuck, they're using test and discussion as a revision module. And for them, I am going to tell you how do you use test and discussion to improve your GT scores and actually get the rank that you desire. For those who are already giving GTs, and let's say your scores are stuck between 110 to 120, because that's the most common range, sometimes it's between 120 to 130. The good thing is that you're already at a basal level, which ensures you are top, at 100, 200, 120 in GTs, you're going to get a 40, 30, 40,000 rank. You're already ahead of around half of the competition. Let's put it this way. You're already ahead of the half or 70% of the competition. Let's put it this way. By giving these tests on a weekly basis, you'll get the confidence that you're continuously improving. Once major subjects are done in a test and discussion, and major subjects are always done first in a test and discussion. In a test and discussion, if you go through the schedule at the DBMCI, you have medicine and surgery occurring very early. You have anatomy, medicine, surgery, all these subjects occurring early. What will happen is you'll immediately get a source of concise notes for these major subjects, and you'll also understand how to give MCQs of these major subjects. So when you start giving your GTs again, let's say in March, after 1 month of your test and discussion, one day prior to giving a GT, use these test and discussion concise notes and see your score booming. A lot of the times, what basically happens is that, uh, you know, subject wise, you might be really good. One subject very good, another subject very good. But when you give a GT, those 200 questions, they overwhelm you. What's going to happen when you have given these 3, 4 subject tests after that? When you revise these 2, 3 important subjects, revise medicine, surgery, and anatomy, let's for example, a hypothetical example, and then you give GT, you'll see an improvement in your score. That score is going to boost your confidence, and that boosting confidence will result in a sort of a feedback loop where you will keep on improving with your scores, you'll keep on improving the scores of your subject-wise test. So this is how a person who's giving GT but stuck can start. Basically, those who are not giving GT after 2, 3 subjects, by giving subject-wise tests, you will have that MCQ solving ability. You'll get the confidence to start giving GTs. Those whose scores are stuck means they're already at 120, 110. They're already ahead of the 60, 70% of the the competition. Now they want to get into the top 10, or not top 10, but top 5 or top 99 centile. For them, these notes are going to serve what? They're going to serve as like quick revision rockner 1 day prior or 2 day prior to the GT. So start using these notes 1 day or 2 day prior to the GT. You'll see a rapid, markable improvement in your GT scores. And this 1, 2 day prior GT revision, via GT revision, has to become your last 1 week revision towards the end. It has to become a last 1 week revision towards the end. This is how it's going to happen. This is how it's going to happen. Now, so I've talked about how do you improve scores. So I've talked about how you are going to improve score. This is the most important part. Use these notes as quick revision rockner prior to the exam. That's the easiest thing that you can do. Now, coming to the last part of this discussion, I've been a little fast with this discussion. And is there any doubts with anyone? They can ask me in the comment section for the people who are watching it live. If you have any doubts related to that, you can ask me in the comment section. What's going to be the ideal scenario? how do you use a test and discussion? How I use, if I got a really good rank, let me tell you the ideal scenario that can help you. So the test and discussion is going to end somewhere around May end. Now you might think if it's going to end around May end, you actually have just 1 month to the exam, it will be a little bit less sufficient for the revision. And you will be absolutely right. You have to make a schedule around this test and discussion that you complete your first reading or you complete your revision by April end or April mid. That is the ideal scenario. That is the ideal scenario. And you would realize that in the test and discussion schedule also subject wise, you'll realize the subjects which are kept towards last, most are minor subjects. All right. They're subjects like, basically derma, psychiatry, minor subjects are kept towards the end. And the major subjects are already done in the initial part itself. So the goal is when you have a topic, when you have 1 week for a major subject, complete that major subject. Let's say you have 1 week for a minor subject. In that 1 week, complete two minor subjects. That minor subjects, give 3 days for that minor subject and 3 days for another minor subjects, which you yourself will do once. All right. Along with reading the notes, you probably would have either pre-made notes, you already would have some notes which you have made earlier. Read those notes, solve the previous year question, solve important topics Q bank, and you'll be getting the access to the Marrow Q bank, right? So if you have Marrow Q bank, you get PYQs, you get a good Q bank. Read the notes. Do Yes, I know it's up to June 6th. It's still May. That's why I say May end. What I'm basically trying to tell you is that your syllabus, your one read should get done by April 15th. When you have 1 week, if you have 1 week for a minor subject, complete two minor subjects in that. If you have 1 week for a major subject, complete the major subjects in that. In this way, you should be able to complete around 90 to 95% of his syllabus by April 15th. Read the notes, concise those notes yourself a little bit. Do the previous year question of the past 5 to 7 years. Do important topic modules. I made a video on my channel also on how to solve, Q banks also. You can refer to that a little bit. But basically, this goal should be, let's say 1 week, I read the entire subject. I did the important previous year question. I did important QBank. I gave the subject-wise test as the test basically with full preparation. I made my own set of concise notes. For the minor subjects, the test and discussion notes itself are your last 1 week revision points. For the major subjects, the topics which are covered in the test and discussion, just mark those topics in your main notes. They become your last 1 week important time points. Last 1 week becomes your test and discussion notes, along with the important top points in your major subjects, along with the important bookmarks of your Q bank and PYQs. If you revise these three things together in the last 1 week, along with the test and using this test and discussion as a schedule, I can guarantee you'll get a top 5,000 or 10,000 rank. That's something which I can guarantee. That's something which I can give it to you in writing. All right. For those who are saying they're already having DBMCI live classes, no, you don't need to make concise notes again. Uh, the reason concise notes is for those who are using an online platform or who have already prior studied from an online platform. Those notes are a little more bulky a little more bulky in general. Those who are using live classes or those who are in a regular face-to-face batch, those notes by definition are concise. Maybe around 10 or 20% cutting down is required, but otherwise cutting down is not required. Those notes will be around 2000 to 3000 pages. You should probably get them around 1500 to 1800 pages. That's about it. The actual concise work is done by those who are already doing 8,000 pages of online lectures, which they did in third, fourth year. That's for them, concising is more important. For those who are in a regular face-to-face batch, for them, or a regular online live DBMCI live kind of a batch, your notes are already mostly concise, maybe around 20-30%, 20% trimming is required. Otherwise, it's not required. For those who are in a test and discussion, what should be the ideal scenario? Like I told you, major subjects, give that 1 week to that subject, read the notes, do important previous year question, do important question modules, mark those important modules, and trim those online notes. And you will also get concise notes from the discussion part of the test and discussion. The notes that you get from minor subjects are actually adequate. And for the major subjects, the important topics which are marked along with bookmarked previous year questions, these three things together done in last 1 week, ulti karke aao, literally vomit it out, this information, revise it in last week, 1 week, vomit it out, and you will be in a top 5,000 to 10,000 rank. This is a simple idea. This is what I actually did, frankly. I used my test and discussion to make a schedule. During my time, the test and discussion was a little longer. It was a 1 year one. I used it to make my notes. get done with my one reading by, in a 7, 8 months, or around a 7, 8 months period of time. After that, for minor subjects, I use the test and discussion notes only for revision. For the major subjects, I use first aid. I put the test and discussion notes into first aid, along with the previous year question, and use first aid for first and second prof. A lot of you know how I use first aid. So you can, for you in your case, major subjects, you can mark the important topics instead of using first aid. So now it's, if you don't want to use first aid, but otherwise I'm not going to, that's not a different point. But now the major subjects, let's say medicine and surgery, what, for example, in medicine surgery, they will teach you all the important emergency, they will teach you about trauma, they will teach you about breast, they will teach you about ABGs in medicine, they'll teach you about the ECGs in medicine. Those are the important topics. And the other things, they're not that important. You read them once in that 1 week, you're done with it. It's in your baseline memory, good enough. But for the revision part, you now know from the test and discussion what are the important topics, you have marked them. And during the last week, you're revising them along with important PYQs. That's about it. All right. For those who are targeting INI-CET, the schedule basically uh, turns a little more quicker. Like now you have to complete the syllabus not April 15, but by March 31st. That's all I'll advise. One revision in April, another 15-day revision in INI-CET. That's how you have to modulate your revision plan. If you're targeting INI-CET, now you have to do it a little more concise. By March end, most of the major subjects at least will be done at the test and discussion. So you have to figure out a way to do your minor subjects also in 1 or 2 days in between, giving 5 subjects for major read and 2 subjects to minor, 2 days to minor subjects, getting it done by March 31st, another revision in April, 1 15-day revision in May, and then giving the exam. But having said that, 3 months just for INI-CET, ideally INI-CET preparation should have started from January 1st, to be very honest. But if you're starting from today, 3 months a little tight. I'm being very honest. No exam is cleared in 1 week or 10 days. Those who say that they cleared the exam by studying 1 month are lying. 3 months is a little tight for INI-CET. I hope that you have already done some subjects by now. Your goal should be to get done with your first reading and first revision by March end. That's the one thing I would advise you. I would say that you should, if you're going to use one shot for revision, combine combine the test and discussion notes of major subjects with one shot along with one shot. That's more than enough. All right. We do not have a test. Acha, you are asking from the DBMCI one part. So in DBMCI one, I do agree that the we will figure it out. I think this is a really genuine question. We'll figure it out. Uh, for the DBMCI people who are just using DBMCI 1, I will figure it out that how can you use a TND videos. Yes, we have TND videos there also. They are more of MCQ discussion videos rather than a test and discussion, to be very honest. But sure enough, we'll figure out a way where we can get you the test so that you can use the test and discussion videos. Sure enough. Yeah. All right. So this is for the people. Get done with your subjects by April 30th. Major subjects, 1 week. Minor subjects, in 1 week of minor subject, do 2 minor subjects. Get done with your in April, 1 month revision in May, another 10 15-day revision in June. Plain and simple. For as far as content part is concerned, for minor subject, test and discussion notes mostly are enough. For major subjects, in your main notes, mark the topics of the test and discussion along with important previous year question and QBank modules bookmarks. Revise that in the last 1 week, give the exam, you'll be golden. Very simple, straightforward strategy. All right. Very simple, straightforward strategy. Okay. With this, I think I'll take your leave. This is how you can use a test and discussion. How is the test and discussion schedule? So we have the major subjects in the very beginning: medicine, surgery, anatomy, all. And we're going to start with anatomy, then medicine, surgery, and everything. And subjects, in fact, pediatrics is probably the second last or the last subject, to be very honest. All right. So that is how we are going to subject that. First, the major subjects are at least done by March, April, and then we are move on towards the minor subjects. Your goal should be that you do the major subjects, and with 1 or 2 days of your own free time, somehow figuring out, you do the minor subjects so that by April you are done with all the subjects. Of course, Ram, if you're done with your classes and you're done with your notes once, you can not get a 1500, you can get a top 15 rank also, yeah. You have 5 months for revision. Use them properly. All right. 5 months done with classes, you have your notes, revise them again and again and again with a and try to concise your notes with every read of your notes. Get them to something which you can revise in last 10 days, and you can not get a top 15, and you can get a top 15 rank. Why not? If you're done with the classes and read, if you're already done with the classes, you have 5 months for revision again and again. What all subjects need to be updated? Frankly, to be very honest, maybe just pharmacology and a little bit of medicine. Apart from that, they're not major. A little bit of most faculties will give you a set of updates. The new drugs, pharmacology, a little bit of updates in the ACLS, a little bit of updates in the ATLS, in medicine and surgery. That's about it. Rest of the subjects usually say more or less the same. All right. For who's asking. Yeah, so that's the thing, right? Med Set Go, that you should not try to do everything, and you cannot do everything. In fact, your goal should be to restrict to the high yield topics. First, get done with high yield topics. If you still have enough time, maybe then you can do some medium yield or low yield topics. But the focus first should be on high yield topics, and that's the best part about test and discussion. It helps you identify the high yield topics as well, because nothing low yield is being covered in that one day of test and discussion. So at least in your notes, you know that these are the important topics I have to revise before the exam. Uh, I don't think so. As far as change in schedule is concerned, I'll be very honest. I agree that the exam is scheduled on June 15th. It's ending in May end. Trust me when I say this, there's a good chance NMC is going to postpone. There has not been a single exam in the past 4 years which has not been postponed. And this time also, for example, with the way the counseling has been going on and the way the things have been going on, June 15, a little bit unlikely, I'll be honest. All right. With this, I'll take your leave. I think most of the questions have been covered. With this, I'll take your leave. eGurukul 4.0 are good enough. You really don't need update with DBMCI 1, maybe except in pharmacology, a little bit in medicine. That's about it. If you're already done eGurukul 4.0, that's fine. You don't need to switch to the next set of notes. All right. With this, I'll take leave. Thank you. Thanks a lot for being a lovely audience. All right.
Thank you, sir.
Yeah, I'll go.